Welcome everyone. This is Alveoly E-learning. My name is MK Obin. I'm one of your course instructors at Alveoly E-learning. The main purpose of Alveoly E-learning is to make learning simple and easier for all students, irrespective of where you are. All you have to do is to get access to a mobile phone, a computer or a laptop with an internet. Then you just sign up to www.alveoly.com. Okay, then you just get your pen and paper. When you log in, you have access to various courses. Then with the course that you have your interest in or you have difficulties in, then you sign up to those courses. So when there is flood, okay, what happens is that there is overflow of water because our gutters are choked up. So in the same way, when there is a blockage of these lymphatic vessels, then it means that the fluid cannot be drained to where they are supposed to drain, leading to excessive accumulation of fluid. And this can occur in cases of elephantiasis. Or filariasis. So you could see that there is edema formation in this particular condition. But with this particular condition, the main thing that happens is that there is blockage of lymphatic vessels. So because there is blockage of the lymphatic vessels, then it leads to edema. So in an exams, if you see that the question says that a patient develops an edema as a result of probably the presence of a condition known as filariasis. Then you know what we are talking about. So you can use this one to explain that particular condition or that particular concept. So in explaining the pathophysiology of filariasis, you can just say that when there is an exposure of an individual to this particular condition, it leads to blockage of the lymphatic vessels. Then when there is blockage of lymphatic vessels, then it leads to excessive accumulation of fluid, leading to edema formation. Okay. Then the fourth point of which edema can occur is that when there is ineffective venous drainage. Okay. Our body contains blood vessels, and the blood vessels, we have arteries, veins, and capillaries. However, our main concern here is the veins. The veins help to send deoxygenated blood to the heart for it to be oxygenated. And these veins have valves in them, and the function of this valve is to prevent the backflow of blood. However, when there is a condition in the body that affects the movement of the fluid or the blood from the veins to the heart, then it leads to venous stasis or excessive accumulation of fluid in the veins, which can lead to edema formation. So for instance, patients with heart conditions like heart failure present signs of edema. Why? Because the heart is not able to function effectively. Hence, there is poor circulation in the body, and when there is poor circulation in the body, there is poor venous return. When there is poor venous return, it leads to accumulation of fluid, especially at their lower extremities, leading to the formation of edema. Another example is that when you sit in a car for a very long time, or you are going to a long journey, you realize that when you come out of the car or you've gotten to where you are or your destination, you realize that you have swollen feet in some people. Okay, and that swollen feet is as a result of a poor venous return, since the person has sat at one place for a very long time without effective circulation, and that is what results in the swelling of the feet, leading to edema formation. So basically, that is that. So in summary, for edema formation, we said that one, edema can be formed when there is an imbalance between hydrostatic pressure and oncotic pressure. Okay. Then with this one, most of the conditions that we mentioned are conditions affecting the liver. We also made mention of conditions affecting the kidneys where there is excessive loss of protein through urine. Okay.